We are just very excited today to have 3 outstanding awards to award to some individuals and organizations that have really done a lot for public health and public health nursing over the last year and over time. And so if you will just help me in honoring these people, that would be fantastic. And I feel so incredibly lucky to be able to do this first award. The first award that we'll be doing today is the 2019 APHN Legacy Award. And the Legacy Award is APHN's highest recognition. It's a lifetime achievement award that's given to an individual who has made significant contributions to the practice of public health nursing over a distinguished career and who inspires innovation and positive change in the world around them. APHN posthumously presents the 2019 Legacy Award to Kathleen Gremmel. And here to accept on behalf of Kathleen today is her colleague, Pamela Dudley. I can't talk now. I'm trying not to get emotional, I'm sorry. Pam Dudley, thank you so much for being here. I'll go ahead and read her award if that's all right. And unfortunately, Kathy's husband was not able to join us today. We did offer a video link for him, and he has a commitment to tutoring physics students where he is in California and wanted to keep that commitment, but we are recording it and we'll be really happy to be able to send this to him and for him and his children to enjoy. So a little bit about Kathy and why she is so very special to public health nursing. Kathy's early path to public health nursing began in a diploma nursing program at the Presbyterian Medical Center in Denver in 1972. After becoming an RN, Kathy was truly a lifelong learner, and she earned multiple academic credentials, including a Bachelor of Science in Nursing from the University of Northern Colorado in 1976, a Family Nurse Practitioner Certificate from the University of Miami in 1979, a Master of Science from Boston University in 1983, and a Doctor of Philosophy from the University of Rhode Island in 2013. Kathy's professional path led her to public health early in her career. In 1976, Kathy married John Merrill and they moved to Miami, Florida, where Kathy ran the health clinic for the, I'm gonna mess this up, Miccosukee tribe in the Everglades. In 1981, Kathy and John moved to Rhode Island and she pursued her master's degree at Boston University while working part-time at the Visiting Nurses Association in Providence. In the years that followed, Kathy's nursing career led her to diverse experiences, including the following. 1972 to 1979, Weld County General Hospital in Colorado and the Dade County Department of Health in Miami, Florida, where she held staff nursing positions. 1979 to 1981, Miccosukee Indian Tribe of Florida, where she served as Chief Health Professional and Family Nurse Practitioner, directing all health programs for the 600-member tribe located in the Everglades. 1989 to 1992, Visiting Nurses Association of Washington County, where she served in several roles, including interim co-executive director, leading the 9 million home care agency visits during the 15-month search for an executive director. She administered all relationships with the area hospitals, physicians, and board of directors with over 92,000 visits. Director of Evaluation and Planning, developing and implementing agency-wide quality improvement plans. Director of Clinical Services, overseeing the day-to-day operation of all clinical services and programs during a period of high growth from 42,000 visits to 92,000 visits. In 1983 to 1989, she served in the Visiting Nurses Association of Rhode Island, where she served in multiple roles, including Clinical Services Manager, overseeing all clinical operations of $10 million in home health and public health programs with over 150,000 visits. Director of Planning, Research and Development, coordinating all planning activities, implementation of marketing department and customer service plan, leading 2 research projects, and assisting with preparation and startup of 2 new subsidiaries. Supervisor of Parent-Child Health Unit, supervising nurses providing pediatric and maternal child health services. Between 1992 and 1998, Visiting Nurse Association of Rhode Island of Lifespan Diversified Services, where Kathy served as Director of Pediatric Services, with responsibility for all the forecasting, budgeting, and operations of $1.5 million multi-company pediatric program. She also led division-wide project teams to institute new programs or meet regulatory mandates. 1998 to 2002, Neighborhood Health Plan of Rhode Island, where Kathy served as Director of Utilization Management, with responsibility for utilization management, case management, quality improvement projects, and new program development. 2004 to 2014, Ocean State Community Resources, where Kathy served as a nursing consultant to programs for children with developmental needs. 2006 to 2014, also served Rhode Island College, where Kathy launched her academic career and served as an assistant professor of nursing, consulting on projects related to case management and care coordination. Near the time of John's retirement from the university in 2014, Kathleen developed ovarian cancer. After surgery and chemotherapy in 2015, she and John moved to San Luis Obispo, where Kathy joined the staff of the San Luis Obispo County Health Department. In the years that Kathy worked at the San Luis Obispo County Public Health Department, she made a lasting impact on the community and her coworkers through her keen intellect, endearing personality, leadership abilities, and love of public health. During her tenure, she led the success of the Child Death Review Team, SIDS Prevention Project, Perinatal Mood and Anxiety Disorders Project, the Universal Screening Program, Navigate San Luis Obispo, the Comprehensive Perinatal Services Program, and appreciably contributed to numerous committees and causes. And all of that was started in 2015, and it's now 2019. That is an incredible amount of work in a short amount of time. Comments from her colleagues at the San Luis Obispo County Health Department included, her good humor and unmistakable brilliance will sorely be missed by all of us. We were very fortunate to have Kathy's brilliance, extraordinary personality, and deep commitment to the public health, especially for moms and babies in her work for the maternal and child health program. In 2017, Kathleen suffered a recurrence of her cancer and resumed chemotherapy. In late 2018, her condition worsened. Kathy passed away January 14th, 2019, at home in San Luis Obispo, California, surrounded by her family. As a professor of nursing and public health nurse for over 45 years, Kathy inspired and mentored so many students and professionals, readily sharing her wealth of knowledge, experiences, and love for public health. She never hesitated to step forward and generously help others, giving of her time and talents with thoughtful guidance. And in fact, she was actually the very first person to welcome me to APHN. The very first conference that I attended was only a couple of years ago in San Diego. And like a crazy person, I had opted as my first experience with the organization to run for president. If you were at San Diego, you might remember that we had our reception on a boat in the bay. And I walked onto that boat feeling a lot of trepidation and nervousness. And this just really bright and radiant little person came and plopped down next to me and just started talking to me and smiling. And she was just incredibly warm and welcoming and just really, I can't even imagine having a better welcome than Kathy gave to me into the organization. And even last year, she was here still doing poster presentations, even in the middle of her treatment. And of course, even then, just as bright as can be, smiling, welcoming, just an incredible soul. And so I'm so honored, given that she was the first person to welcome me into this organization, to be the one to award her today. To honor Kathy's public health nursing legacy, APHN has established a Kathleen Gremmel Memorial Fund within the APHN Legacy Fund. Donations provided to APHN in Kathleen's memory will support educational programming within APHN. There are envelopes on each of your tables to receive Legacy Fund donations, or you may contribute through the APHN website donation button and indicate that your contribution is designated in memory of Kathleen Gremmel. And again, we have Pam Dudley here of the San Luis Obispo Health Department, who is also serving as our APHN regional representative for Region 9, so thank you for that, to accept the Legacy Award on behalf of Kathleen.
Did I say something? Or?
She was wonderful. Thank you for the nomination.
Okay.
I just want to say I wasn't lucky to get to work with Kathy for her last 3 years, 4 years, I can't keep track. And I don't think any of us, she got the ovarian cancer in 2015 before she really came to us. So we really thought she was going to make it through this next bout because we used to talk about the Denver conference, and she didn't make it. So I guess I wrote that for you. I can't remember all the stuff I wrote because it was a while ago, and I'm not sure what else I can say. But I will make sure her family gets this. And she was a real honor to work with her. It was really an honor for our county to get someone with that level of experience. We're kind of a middle-sized county in the middle of San Luis Obispo, in the middle of California, and we don't even have a BSN program locally, So it's like getting someone who really knew public health and to mentor our staff and stuff is just wonderful, and she's missed by all of us. Thank you.